Hi, let me introduce myself again as anti-hepatitis B agents. And these are my generic names with brand names. My therapeutic actions is that I inhibit transcriptase in the hepatitis B virus and cause DNA chain termination, leading to blocked viral replication and decreased viral load.
Pharmacokinetics. I am rapidly absorbed from the GI tract with peak effects occurring 0.5 to 1.5 hours for the entecavir, 0.5 to 4 hours for the adipavir, and 1 to 4 hours for telbivudin. Entecavir and adipavir are metabolized in the liver and excreted in the urine. Telbivudin is excreted unchanged in the urine. Adipavir has a half-life of 7.5 hours. Entecavir has a half-life of 128 to 149 hours. And telbivudin has a half-life of 40 to 49 hours. It is not known whether of any of these drugs crosses the placenta or enters the breast milk.
My indications is that treatment for adults with chronic hepatitis B who have evidence of active viral replication and either evidence of persistent elevations in serum aminotransferases or histologically active disease.
Contraindications. I am contraindicated to the patient who has allergy to me, lactation, and you should use caution when using me to the patient with renal impairment, severe liver disease, and pregnant women because the effects on the fetus is not known. My adverse and side effects are headache, dizziness, diarrhea, nausea, elevated liver enzymes, and a potential risk for hepatitis B exacerbation could occur when I am stopped. Severe hepatomegaly with steatosis that is sometimes fatal is reported when using adipavir and telbivudin, and lactic acidosis and renal impairment is reported when using entecavir and adipavir.
For the nursing responsibilities, in assessment, assess the patient for contraindications and cautions. Next is perform a physical assessment. Also, assess level of orientation and reflexes. Lastly, evaluate renal and liver function tests. And for the nursing diagnosis, acute pain related to CNS and GI effects of the drug imbalanced nutrition. Less than body requirements related to the GI effects of the drug. And lastly, deficient knowledge regarding drug therapy. And for the planning and implementation, monitor renal and hepatic function prior to or periodically during drug therapy. Withdraw the drug and monitor the patient if he or she develops signs of lactic acidosis or hepatotoxicity. Caution patient to not run out of this drug but to take it continually. Advise women of childbearing age to use barrier contraceptives. Advised women who are breastfeeding to find another method of feeding the baby while using the drug. Advise patients that these drugs do not cure the disease and there's still a risk of transferring the disease. And lastly, instruct the patient about the drug prescribed. And for the health teaching, instruct the patient to have a regular blood tests and medical follow-up. Next, instruct the patient to take precautions to avoid running out of the drug because it must be taken continually. Realize that GI upset with nausea and diarrhea is common with this drug. Report severe weakness, muscle pain, palpitations, yellowing of the eyes or skin, and trouble breathing. And for evaluation, monitor patient response to drug, monitor for adverse effects, evaluate the effectiveness of the teaching plan, Monitor the effectiveness of comfort and safety measures and compliance with the drug regimen. That's all again for my autobiography. Thank you for watching.